Private member statements. I call the member for Maitland.
Thank you, Mr Speaker. I rise to speak on a matter in which every constituent in my electorate has a stake in, and that matter is the new Maitland Hospital, which was promised by this government back in 2011, 6 years ago. In the 6 years since the initial announcement was made, it's been marked by broken promises, backflips and constant obfuscation by the Farrell, Baird and then the Berejiklian governments. For those who do not know, Maitland is the fastest growing city outside of Sydney and has grown by some 15.5% in the last census. The growth our town is experiencing is wonderful for our local businesses and our local community, but unfortunately is contributing significantly to a huge strain on our local infrastructure and resources. Our local health staff are some of the hardest working health professionals in the country in a hospital which has not been expanded since this government came to power over 6 years ago. They're overworked, they're under-resourced. My office is inundated with calls from concerned members of the community, from doctors, from nurses and other health staff. Patients tell me daily of the issues they have in accessing services in our hospital where the dedicated staff are being stretched beyond belief with inadequate bed numbers and there is not enough staffing to meet the increased needs. A few weeks ago, the government finally did admit, after 6 long years of waiting, that they would start construction on this hospital this year, and I thank the Minister for Health for that concession. The Minister also admitted that the hospital that was originally planned needed to be larger and promised another $50 million. But it beggars belief, Mr Temporary Speaker, with a $4.5 billion surplus, that this government cannot put its hands further in its own pockets and walk away completely from the PPP. The Minister has said that he has walked away from a PPP because he's no longer going to tender this out to the for-profit sector. However, he will be tendering it, if all goes to his plans with the EOI, to a not-for-profit provider. Now, Mr Temporary Speaker, there has been a widespread grassroots campaign which has involved unions, health staff, residents and others who have all prosecuted the argument against a PPP. And a not-for-profit or an NFP is still a PPP. It takes away the leadership, the ownership of this resource from the public. I'm proud to have been part of that fight, but the fight is not over yet. Our community has a number of concerns about the model that's been put up by the Minister here. Just like a for-profit provider, a not-for-profit provider will seek to recoup their investment in the new hospital. There is no question that this will come at a cost to our local community, who will use this hospital individually, and because we will lose our only public hospital without one to replace it. It will also place pressure on our existing public hospitals as people tend to go towards those. There is a wide range of concerns about the clinical services that will be provided at the new Maitland Hospital, and the government has been very tight-lipped about this issue. In fact, earlier this week I wrote to the Minister requesting the clinical services plan and also to the head of the local area health district. Our community needs and deserves all the essential health services at our new hospital that were originally promised. We need chemotherapy, we need radiotherapy, we need lymphedema, ICU, we need the whole gamut of services. When it was originally announced that we were promised a John Hunter-sized hospital, our new hospital should offer services comparable to that of the John Hunter, and it shouldn't be sold off to the not-for-profit sector in order to deliver it. There are also concerns about the sort of services that will be offered by a not-for-profit faith-based organisation, which I have raised with the Minister. Faith-based providers in other jurisdictions have refused to provide services based on reproductive health, and there is no reason why people in Maitland and the surrounding areas which rely on the public health system should be denied access to this important area of medical health. As I've said previously, our health staff in Maitland are some of the hardest working in this country. The government must guarantee them working conditions that they deserve. Doctors, nurses, ancillary staff must maintain the same rights and conditions they currently possess in the public system. And earlier today, the Minister and the Parliamentary Secretary for the Illawarra both talked about their concerns on this area, but I have to tell you that these concerns have not been addressed to the satisfaction of those who work in the sector. Other concerns over the not-for-profit provider model include the lack of mandated nurse-to-patient ratios, which will have a direct impact on the quality of patient care. Back in May, hundreds of residents attended a forum in my electorate concerning the hospital's future. We have a 10,000 petition signature which will be debated in this place on the 14th of September. Since my election in 2015, my community and I have fought for our new hospital to be a public one. We've come too far in this battle to lose our public hospital at the final hurdle. The government has come to the party on a number of our concerns and we've had significant wins. We just want it to be a public hospital. Thank you.
I'd like to thank the member for Maitland.